Is there a vaccine shortage? Is there a vaccine wastage? How exactly are the hospital beds and are they completely occupied? To discuss on all that and much more, it gives me great pleasure to bring on board Dr. Behram Pardiwalla, Head of Medicine with Wockhardt. And I must share with our viewers that I have consulted Dr. Pardiwalla at various occasions in the past, and trust me when I say that he's one of the finest doctors in Mumbai. Dr. Pardiwalla, good morning. So nice to connect with you.
Thank you very much. Good morning.
So, sir, what is the ground reality? What is happening in hospitals? Do you think in Mumbai have private hospitals run out of vaccines?
Well, let's look at it this way. Our hospitals are running absolutely full. As of this morning at 8 o'clock, we have a waiting list of 30 patients for ICU and more than 120 for ward beds. I mean, the pressure is tremendous. Patients are moving from hospital to hospital in ambulances. Yesterday morning, I had a call from a patient whose husband was moving around in an ambulance seeking admission. And because his saturation was low and my ICU is full, we just couldn't help the patient. So, and of course, if you're talking about vaccines, absolutely. We vaccinated 200 people yesterday. We have asked for more vaccines, and the municipality has ensured that yes, definitely, they would be giving us more vaccine. The government is also working on it, trying to get us more vaccine. And, as far as the Serum Institute, etc., are concerned, and the Hyderabad lab, they're trying to ramp up the production so that we can get more vaccine. So by the end of the week, we'll have a much better and a clearer picture. In the interim period, we have a lot of pressure of people coming in and asking for vaccines. And we are doing our level best in trying to help them out.
Has the vaccine shortage suddenly emerged because of preference, which is there are some who prefer vaccine from Serum, there are some who prefer vaccine from Bharat Biotech. Since the vaccine has a shelf life, this entire preference and choice is also leading to vaccine wastage?
I understand what you're trying to say, but let me tell you that this initial choice was there about 2 to 3 weeks ago. But after the latest data that has come from the Covaxin group, I mean, the patients just don't bother. And even we, as doctors, tell them whichever vaccine is available, please take it. Initially, of course, there was a rush for the Covishield and very few people for Covaxin. But now, absolutely, whichever vaccine is available, we give it. In between, we were only giving Covaxin, then we are giving Covishield, and now we are giving either one. Whichever one is with us, we give it immediately. So at the moment, there is no such thing as a patient's choice. That was about 2 or 3 weeks ago, but I think that's obviated now.
Dr. Pardiwalla, first it was a pressure on the infrastructure. Now we've discussed the shortage of vaccine. Is there shortage of other critical medicines also, like remdesivir?
As of now, this time in this present epidemic, our hospital, our supplies department is not flagged that remdesivir is going to be in short supply as of now. So far, we are able to give it to every patient without any hassle. But if this trend continues, I do think that over a period of time, remdesivir may get into short supply. Yes, what we lack is doctors. We are very short-staffed. We don't have enough doctors to go around. And try and understand that these kids work 12-hour shifts in those heavy personal protection kits. It really takes a toll out of them. Plus, all of us seniors, looking at about 50, 60, 70 patients a day, constantly concentrating, taking phone calls. It's a tremendous pressure. So yes, As far as you're talking about a lack of infrastructure in medical manpower, yes, we are running a little short.
So, Dr. Pardiwalla, given that you're at the forefront of the situation right now, and with the situation being what it is with the shortage of doctors, and now we're talking about these vaccine shortages, do you think that steps like these sort of mini lockdowns or lockdowns are the need of the hour, or that there is perhaps a simpler way to tackle this issue? What should India be doing at the moment?
Look, I don't want to be drawn into any controversy, but I think what should be done is lockdowns really don't serve any purpose because they disrupt a lot of things. What you should do is make sure that you have contact tracing, make sure that you have vaccination, make sure that you have adequate medication available. That is the only way you will be able to break the back of this epidemic. And as we all of us medical professionals maintain, it's over the next 3 to 4 weeks which are crucial. We should not get overwhelmed. This epidemic is somewhat more vicious than the last one because of two primary reasons. One, it's gone into the upper strata of society, the middle class, the lower middle class, the upper class. That's what it's affecting. And those people want to get into private hospitals. And that is why there is such a big rush. And it's widespread. Almost every second person is testing positive. But you must understand that even if you're positive, it really doesn't mean much. Hardly 5% of patients who are positive require hospitalization. And if you could prioritize those, it would go a great way in alleviating the suffering. Until then, of course, you have to vaccinate, you have to do contact precautions, and you have to test more.
Okay, thank you so much then, Doctor, for taking time out and for all the amazing work as well that you're doing.